Hello, everyone. Thank you for joining us today to discuss about Latin American healthcare. My name is Mariana Romero Roy. I am Global Health Intelligence Director of Business Development and Market Intelligence, and I'll be your MC today. Before we begin, I just want to give you a little bit of information on the structure of this webinar. We will have poll questions, actually 3 of them, as we move forward with the webinar. And you can also go ahead and input your questions at any time. If you look at the bottom of your screen, there is a Q&A button that you can hit at any time to put those questions. So after more or less 50 to 55 minutes, which is the length of the webinar, we will address these questions right after the webinar. Also, just so you know, most of the information we will be discussing today comes from this year's edition of our white paper, the 2019 edition of our Healthcare Trends and Transformations white paper. This is actually our 4th edition. We're very excited about this. Bella, if you can please go to the next slide. Now, as you can see on screen, a little bit of information on the history of the company. So just so you know, we've been doing market research and market intelligence for more than 20 years, but decided to focus on the healthcare industry about 5 years ago. And ever since, we've been gathering very unique and actionable information through different services and obviously through these white papers. Here, just a little information on the 4 services that we offer today. So when we launched the company, we basically did ad hoc research, which is a wide spectrum of opportunities for clients. As you can see, it depends on the needs. We can do competitive profiling, best practices, among many others. But from this experience, we were able to develop very unique off-the-shelf services across Latin America. The first one is Hospscope, and it's the world's only and largest hospital demographics database with information on more than 17,000 hospitals across the region. Then we came up with Surgiscope, which is also the only database available with information on procedure volumes in Latin America. Last but not least, we have ShareScope, which is a unique methodology we developed to actually do market size and market share analysis through import data. And again, it is very unique. Here, just to give you an idea of the clients that we have nowadays, and also the media partners, which obviously back us up and are always interested in, the white papers and infographics, rankings that we come up with on a yearly basis and that have helped us stand as the leading market intelligence firm in Latin American healthcare. Today we have great panelists. I'm very excited. So today we have with us Global Health Intelligence's very own CEO and founder, Guillaume Corpart, as well as Bill Garcia from RICO. He is the director of the health vertical. Patricia Ocampo, she takes care of strategy and business transformation at Philips. And of course, Juan Carlos Rodriguez, he is the CEO and supply chain director at the Fundación Cardioinfantil in Colombia. In terms of what we're going to be talking about today, Guillaume will start us off in a minute, just giving us an idea of where Latin America stands in the global context. We will also be delving into 3 specific healthcare megatrends, so aging population, non-communicable diseases, and the lack of efficiency, followed by growth and opportunities, and as I mentioned previously, the Q&A section. So without further ado, Guillaume, please let us know a little bit about where Latin America stands today in the global context.
Thank you, Mariana, and thank you everyone for joining us today. A particular thanks also to all our panelists, which I know personally and have worked with and collaborated with for many years. It's a pleasure and an honor to have you guys with us here today, so thank you all. Abel, please to the next slide. When we look at the number of hospitals on a global level, we're talking about approximately 100,000 institutions. That's 100,000 institutions providing healthcare worldwide. Now, of that, about 25% or a quarter of the world's hospitals are based in developed economies, namely the United States, Canada, Europe, Japan, Australia, amongst others. That leaves 75% of the world's hospitals and institutions in emerging markets. And so when we draw a list of the top 10 countries by number of hospitals in emerging markets, it's no surprise that we see China as the leading country. China by itself has approximately 1/4 of the world's hospitals. What is really surprising, however, is that 4 of the top 10 emerging markets by number of hospitals are in Latin America, namely Brazil, Mexico, Colombia, and Argentina. Altogether, Latin America accounts for 1/4 of the world's healthcare institutions. Now, this is a really powerful message because any company that's really serious about long-term growth on a global level must take into consideration emerging markets. And in doing so, Latin America needs to be a central role and a pillar within that growth strategy. And that's why we're all here today. That's why our jobs are important. And that's why healthcare in Latin America is so important for global growth, for many companies, as well as for strategy moving forward. Now, healthcare in Latin America is a big market, and it's also a very big business. We're talking about nearly 22,000 institutions. We're talking about almost 1 million beds and 50,000 operating rooms. This is a really big opportunity. However, it's also very unique, and the dynamics of the Latin American market are very unique when compared to other global markets. For instance, Latin American hospitals typically have on average approximately 46 beds compared to about 160 beds in the United States or in Europe. That's 1/3 of the number of beds and 1/3 of the size of their comparable peers in other regions. So going after the market and understanding the market dynamics poses a really unique challenge for many companies looking to the Latin American landscape. And for many institutions, for healthcare providers, it really changes their ability to leverage infrastructure or to invest in capital equipment, be that equipment such as MRIs or CT scanners or X-ray machines, as well as technologies that may integrate all of this equipment together or that may push the equipment level grade to the next level. Certainly, we can also talk about the software that's behind all these technologies that can make the imaging equipment integrate and talk to one another, as well as the simple infrastructure of the business. So it's not only a question of the type of equipment and the size of the hospital, but it's also a question of how each institution is using that equipment, how that equipment integrates into the institution's strategies. And we'll see that we're moving away from a chain-linked fence of having a provider to user to an end user to a much more holistic approach of integrating solutions together really to deliver better care to the patients, whether that be from the commercialization standpoint of this equipment or technologies or devices, as well as the utilization that's being made from these institutions. Moving on to the next slide. We're now going to look, before we look into the next section, we're going to go to our first poll question. Mariana, please take the lead.
Thank you, Guillaume. As I mentioned, everyone, it's very important for us to gather your feedback on certain topics. So we will begin with the first poll question. So what are your company's plans for investment in Latin America this year? Invest more than in 2018, invest less than in 2018, or maintain investments at the same levels as 2018? Very interesting question right there. Give us a few seconds as we tabulate the information. Hopefully it will be invest more than in 2018. But we'll just have to wait a few seconds to see that. And so once we get this information, I'll give the word back to Guillaume, who will be letting us know a little bit more on the mega trends. All right, great news. So most of you think that the plans for the investment in Latin America this year is to invest more than last year. This is great news. Thank you for participating, and we'll have the second poll questions in a little bit. Guillaume, back to you.
Absolutely. Thank you, Mariana. So over the past 5 years, we've been tracking, mapping, and monitoring the key forces of change that shape and reshape healthcare in Latin America. And we map these forces of change upon two axes, those of lower impact versus higher impact, and also the forces of change that are on a micro level versus on a macro or systematic level. And over the past 5 years, we've really identified that there's three forces of change that impact the rest of the market and that drive healthcare, not just for the years to come, but for the decades to come. The first of which is the aging population, the demographics of Latin America, and we'll get to that in just a second. The second is the prevalence of non-communicable diseases. And here we're talking about specifically obesity epidemic and how that's impacting healthcare in Latin America. Thirdly is the lack of efficiency that we see in the region and what's happening in terms of the payer-provider relationship moving forward. So we're going to start off by looking at the aging population. As it turns out, Latin America is the fastest aging region in the world. Now that's a pretty mouthful to hold on to, and it's a nice little soundbite. But what does it actually mean? Well, it turns out that Latin America has the highest growth rate of the aging population. If we're looking at the demographics across the region, what we're seeing is that the category of 60-year-olds and above is going to grow by nearly 150 million people over the next 35 years. So the highest proportion of folks entering the elderly category across the world. And we just have to think a moment about what this means for chronic diseases, for cancers, for heart disease, for care in general. Where will those people go to get care? How will the institutions of the future look like? Are we talking about a hospital setting like we are now? Are we talking about clinics? Are we talking about home care? Where will care be given? Who will be administering the care? How much will it cost? And who will be funding those sources? Those are all fascinating questions that very few countries across the world, and much less in Latin America, have answers to. But it will reshape healthcare in Latin America for the next 35 years. And there's no way around that. Next, what we're looking at is the obesity epidemic. Now, it's no surprise to many folks here that Mexico is the most obese country in the world, with nearly 30% of the adult population showing signs of obesity. What is surprising, however, is to see that out of the 6 leading economies in Latin America, all of them have obesity rates of over 20%. This is pretty alarming. Coupled with that is the issue that child obesity across the region is over 8%. So we have to ask ourselves, what kind of future are we giving our children? What kind of healthcare future are we leaving the next generations when we're seeing current obesity rates in children of over 8%? And we all know the issues related to obesity, whether that be diabetes, heart disease, or others. And obesity is one of those challenging issues that carries a lot of inertia, which means that we can't really turn it off from one day to the next. Obesity is going to be with us for years and possibly even decades to come. So we really have to think hard about what kind of future we're setting up for ourselves and for our children. Coupled with the issues of aging population and the obesity epidemic is the question of healthcare costs and healthcare expenditure. Certainly the need for healthcare is rising at a very rapid pace, and expenditure is not quite there yet. What we are seeing, however, is when we're looking at the breakdown of expenditure by type of funding, we're seeing that government spending is actually growing at a fairly high pace of 4% per year. What's really interesting, however, is to see that there's a category of funding that's growing at a faster pace still, and those are voluntary contributions. Now, voluntary contributions are essentially people contributing voluntarily to their healthcare. So they're either buying healthcare plans or private insurance products or solutions. And what's fascinating about this is that it means that people in general are taking their healthcare needs into their own hands. They understand that the government may not be there to supply healthcare for them in the long term, that the costs associated to healthcare in terms of financial burden to the society will be so great that the public services may decrease in quality or that the wait times might get excessively long. and that they should probably invest into private healthcare plans for their future solutions. This is changing also the roles in terms of the dynamics between healthcare solutions providers, as we can see on the next slide, with the markets. Typically, healthcare insurance has been reserved for the elite few, socioeconomic levels A, B, and a certain section of socioeconomic level C+. Essentially, the folks who could typically afford healthcare across the region. What we're seeing now is that healthcare products, so insurance companies, are launching healthcare products really for the working class and the working middle class. They're tailoring solutions that are both specific to the needs of the people, but they're also expanding in terms of how they're communicating and how they're getting those products to the market. They're typically making partnerships and alliances with non-traditional insurance players, which is quite fascinating, in order to really broaden the base of access to care and to private care. On the flip side, this is also changing the institution dynamic. So the care providers are also changing. We're seeing an emergence of much smaller private institutions throughout the region, which have very specific needs, either focused on a specific modality or issue or care type. Ambulatory surgery centers are also popping up at a very high rate in order to cater the needs of those people. We're now going to start looking into the growth and opportunities section, but before doing so, Mariana, I believe there's a next poll question.
That is correct, Guillaume. Thank you so much. So this is the second poll question for the webinar. Which equipment categories are you seeing the most demand for right now? Imaging, such as CT scanners, ultrasound machines, MRI machines, among others. Life support, such as ventilators, dialysis machines. Monitors, ECG, EEG, or blood pressure. Or treatment, such as laparoscopic surgery equipment, infusion pumps, among others. Again, very interesting question. We're eager to learn your feedback on this across Latin America. So let's just give it 1 second. For this one, I'm not sure. I'm not quite sure. Imaging, very interesting, perfect. Thank you again for your feedback, which is extremely important to us. So the answer for this is imaging. So.
Perfect. Well, thank you, Mariana. And I'm very lucky and honored to have the presence of Patricia here with us today, who can be able to talk about that in just a moment. So just before we get to comments and discussions with the panelists, when we look at institutions across Latin America, we often use technology as a proxy to understand and to distinguish which are the leading institutions from the lagging institutions. So for instance, in this case, in the case of imaging equipment, we're using the benchmark or the proxy of X-ray machines. And as we can all see, most institutions across the region, approximately 70%, have some form of X-ray machine. However, when we're talking about more sophisticated equipment, such as CT scanners, MRIs, gamma cameras, or even PACS systems, we're seeing that the penetration levels drop dramatically down to between 2 and 7%, depending on the country. Okay. We use this information typically to understand which are the leading institutions to distinguish those from the lagging institutions. And my first question would be to you, Patricia. How does this impact your business at Philips? And from a business transformation standpoint, how do you use these types of metrics, and how do you go about understanding the needs of the institutions that you work with?
Thank you, John. Well, I'm happy to see in this chart that we are in levels of 60 and 70% of penetration of some kind of imaging systems in almost all the countries across Latin America. What I'm not happy to see is that it's in basic imaging. So we have good rates, but only talking about X-rays and maybe ultrasound in the best of the cases. where we have a room to growth, and not as a company, but as countries and as health systems, it's in advanced technology. As you can see in that chart, the CT scanners and MRs, and well, we are not even talking about other even higher as PCTs or something like that. We are in very early stages of development. Even our benchmarks, as it would be maybe the Chilean health system, we have a room to grow a lot. And as you mentioned before, we are seeing now growing the chronic diseases, getting people old in general. So we are going to need much more capacity to serve those people. And here we have other point to review. The quantity of the systems, the penetration of the systems versus the productivity of the systems. We need to assess and to be a consultant to the health centers on how to get the best productivity of the systems that they already have, not only by institution, but by region, by the health system by itself. And that's a milestone in how the companies are working with our partners or other players. We need to be more a consultant, and we would look for the best care of our patients.
You know, Patricia, that's a fantastic point. And I really like to bring the issue of the health systems into place, because it really is an ecosystem. It's no longer just a question of a provider versus a caregiver versus a patient, but really a health ecosystem that we're really trying to bring the level up on. Juan Carlos, from your experience as a care provider and as one of the leading institutions, both in Colombia as well as on a regional basis, firstly, thank you for being here. It's an honor to have you. But could you please tell us how important is technology when you're giving care to your patients, and in this case? And how do you see that solutions providers could really improve the level of care, or help you improve the level of care through technology or through some of these more sophisticated methods?
Hi, everyone. Thank you so much for inviting me, and in fact, invite Fundación Carlos Infantil. It's an honor to be here and share with us a little bit how we are doing things in Colombia, and specifically in Bogotá, where we are located. As we can see in the chart, Colombia is the country with the lowest rate of penetration, even in basic technology like X-rays, because we have a very special condition in terms of geography. We are a country with rural areas spread around the Amazonas, and very, very complicated access in some parts of the country. So we have, honestly, lower rate of penetration, and this is a challenge for government, because we need to definitely improve access. And what we need to do is work together, not only between providers, insurance companies, and medical devices companies, trying to understand how to offer better access to the farthest places in country, because definitely we need to improve the care we are offering in the countryside. So we have a huge opportunity for industry to work together with providers and insurance companies, and trying to offer better access to technology in the countryside. We need to get together and define what will be our master plan between insurance companies, providers, and industry, and establish, once we establish this master plan, start to walking, looking for a new way to offer access to technology. That's my perspective from this point.
You know, and Juan Carlos, you touched upon two great points, which is access to healthcare. It's something that we hear on a regular basis. I think every event and every panel and every symposium that I attend, somebody brings up the question of access to healthcare. And it's not just a question of access, but it's access to quality care in a timely manner, right? That's the crux of healthcare. If we offer second level care or second tier care, it's just going to get people back into the system in the short or medium run. So it's access to quality care, and it's offering it in a timely manner so that people get the care they need in a short span. Because if you need, a bypass, or if you need an implant and you get it, a year from now or a year and a half from now, you might not be around to actually get your surgery. So it's access to quality care in a timely manner. And the second point that you make, Juan Carlos, which is absolutely fascinating, is the question of having two-tier systems between the in-city institutions, which have access to very good, very sophisticated doctors and systems, and then the countryside, the rural areas that really don't have access to those technologies and equipment, or even the knowledge of the doctors that might be on hand. Bill, from your perspective, because you offer technology solutions at RICO, you oversee the region as a whole of Latin America. What solutions are there for healthcare systems, not just one or two institutions, but for healthcare systems that could really help bridge that gap?
Thank you, Guillaume. And actually, like you were stating before, RICO, before we ended up launching the healthcare vertical market, we did a lot of research development and also customers interview to be able to understand the specific needs and requirement. And it was very obvious that when we created the portfolio of the different solutions that we offered to the medical field, it was everything that the objective was really concentrated on how can we make the patient journey more pleasant. Because when we're sick, we're not feeling well, obviously you need somebody to be able to take care of you, provide the best service and all that. But with that, we also need to be able to provide the latest technology. And one of the things that was very obvious from the conversations that we had in the interview with the customer was looking to see how can we improve the productivity of the doctor so they can provide a better service. And one of the solutions that we created going towards the future, it was really what we call the smart doctor. The smart doctor is a solution that is composed of 3 modules. One being the voice recognition, that the doctor actually just talked to a microphone and have all the data enter into the system. The other one is the cognitive module, and the most beauty of the 3 is the artificial intelligence. And how can we make the doctors be more productive, but at the same time to be able to find right away, within seconds, the right solution or the right treatment for the patients. One of the customers that actually bought this type of solution, the smart doctor and the artificial intelligence, was really like a cancer center. And it's obvious that for the doctors, when they have a patient, everybody's different, every cancer is different. So if we have the ability to be able to go into the artificial intelligence and enter and search a specific treatment for the patient, the accuracy would be a lot more, because we have all this data and all these different cases. So I do believe that that's the way of the technology is moving forward, and that's the way of the future.
Great, thank you. Thank you for commenting on that. So in the next slide, what we're going to be looking at is, as we mentioned earlier, Latin America is a big region. It's a big region in terms of number of institutions, in terms of number of beds, of where it's growing. And just to give you a sense of how we're seeing some of these equipment and modalities, as well as the pharma products and technologies moving in the years to come, we're talking about a market that's going to be approximately $15 billion in terms of an OTC market by 2022. $800 billion market for the ultrasound, again, imaging, Patricia, as you mentioned, by 2021. We're seeing high growth rates in terms of respiratory monitoring at nearly 11%, clinical laboratories at 7.5% growth rate through 2025, and MRI and CT, so much more advanced imaging equipment, demonstrating 7% growth rates per year. We're also seeing a region that has a very high potential when it comes to PACS and RIS. So we're kind of lagging in those areas, but in terms of penetration, but that also is an opportunity for our healthcare systems in order to embrace that. Bill, from your perspective, how do you see these growth areas evolving? Are you seeing specific growth areas in certain aspects? You mentioned artificial intelligence and how that can help reduce the number of errors on the medical side. Are you seeing specific markets growing? How's your perspective?
Based on all this statistic that you're showing right now, Guillaume, they're also very accurate, obviously, and it's very relevant that this is where the market is going. But one of the areas that we also see a lot of the growth and penetration is on the telemedicine. And going back to the future of the medicine, where we're going, and since we work in such a large territory, let's say Brazil, for example, is a huge area, and we wanted to be able to provide the best service and attention to a customer or patient, at the point that if we have specialists all over the place and we have the right doctors to be able to do a consultation, I think telemedicine is the key to success, because we can be here with a patient and we can actually have a conference with different specialists throughout the country that they don't really need to be in the same hospital with you or the same clinic. So I think that is another area that we see a huge opportunity. And also 2019, that's one of the main areas of focus for RICO Solutions.
You know, that's a really interesting point. I think it plays right into the hand of what Juan Carlos was commenting a moment ago. How do you broaden access to care? How do you get the rural areas involved in healthcare? Technology, as you mentioned, Bill, plays a central role in that, specifically telemedicine. And just as a side note, this month, some of the data that we publish in terms of telemedicine has been republished in an article in Health Affairs in collaboration with Cynthia LaRouge and a few other authors from FIU. So if you pick that up, you'll see the trends in terms of healthcare, telemedicine penetration within healthcare systems across Latin America. But more getting back to the point of telemedicine in the region, Juan Carlos, can you elaborate a little bit about the role of telemedicine and other technologies within La Fundación Cardioinfantil in Colombia? And if you're currently using such technologies, how are you doing and how do you see the benefits of that specifically for your institutions?
Thank you, Guillaume. In Colombia, we have different telemedicine initiatives, but in Fundación Cardioinfantil, we are working to establish a master plan to implement telemedicine. We are not offering right now, but we consider that it's important because our main focus is in cardiovascular medicine. So we have a huge room for improvement in terms of offer quality of cardiovascular care access in the countryside, using some partners in small hospitals with the infrastructure properly implemented to offer the best care in the rural side. That's our mission. And now what we are doing now is offer physical brigades, transporting the equipment, transporting the cardiology, the team, the heart team, mostly composed by cardiology doctors, but it's too complicated in the Colombian geography, carry out all this hard team and equipment to the jungle in Amazonas. So telemedicine, we consider, is definitely the right path to improve access. So we have in our master plan, maybe in 2 or 3 years, to start offering telemedicine for cardiovascular care.
Great. Thank you for sharing that. Patricia, could you comment a little bit about some of the initiatives that you have in terms of the equipment, the modalities that we see here, and how they relate in terms of the commercialization strategies that you might adopt in order to improve access to care? Oh, I believe we might have just lost Patricia for a moment. All right, so let's move on. We'll come back to this question in just a second. In the meantime, oh, there we go. Patricia, welcome back.
Sorry.
Very good. We were just commenting on how you see the integration of such solutions from a technology standpoint, whether it be telemedicine or some of the modalities that we see here on screen today, how do you see them integrating within hospital systems, and the commercialization strategies, how those are changing in order to really improve and better the care and the outcome for both institutions and patients?
Good, I didn't miss this comment because I would like to, yes, I would like to comment here. I am agree in terms of the solutions that are growing the most, I mean, in the trend for the near future, but also we need to think in the how it's going to happen this. So I specifically would like to focus in the connectivity. We are talking about something around 40% in EMR penetration in the region. Well, it depends of how we understand the EMR concept. And I would like to understand this as in the broadest way that we could. Because when you go to a hospital or any health institution, they maybe say, yeah, we have, but they are only tracking specifically clinical and medical stuff. And I think it goes more than that. When you don't have the connectivity between players, between other institutions, you are losing a valuable resource to really improve the health, to really improve us as companies, and to improve its own patient health. Here I'd like to talk a little broader, and I like to include, for example, the digital information that we have access to. How we are including this, 80% of the population in Latin America has access to internet. And if they have access to internet, maybe they have access to a smartphone or other wearable technology. And how we are getting the information that they have in their phones, in their smartwatches or other technologies, to include that in their health information. So maybe that's a step further, but we need to think in everything and not only in the information that we can share inside in a hospital. Of course, we have in artificial intelligence. We're in Philips, we have it. We have, I don't know if you saw this, but we have now even augmented reality for treatment. And it's super cool technology. And we are leading in cardio technology in this case. But we need to go further and think in connectivity. Until we don't get in that point, I think we are not solving this from the root cause.
Absolutely. And so, your point is very well taken. There's, the future is wide open and it could lead us anywhere. But in the short term, what do we need to do to get there? What are the first steps that we need to do? And what I'm understanding you're saying is that we really need to bring out the connectivity issues within the equipment and the digitalization factor of that, which is, I believe, Bill, along the lines of what RICO's strategy is in Latin America.
Actually, Guillaume, if I can add a point, based on Patricia's comment and your statement, it's very obvious that the digital transformation is the evolution that is happening right now in the marketplace, and it's continue to be the key focus. And how can the providers be like ourselves, whatever, is to integrate all these different type of solutions into one specific centralized system. So at the same time, the patients, the doctors, and the entire staff can have accessibility to the data right away and be able to be in a digital format instead of a paper format.
That's a brilliant point, Bill, and it comes right at an opportune time. I see a question from the audience here about the digitalization of the patient journey. So from start to finish, where do we see that going in terms of digitalization of the patient journey? I'm going to leave it on pause for just 1 minute so that we can go on to the next slide, and we can maybe circle back to that point in the Q&A section. Okay. So every year we monitor the installed base of equipment throughout Latin America in 14 countries. This is through our solution called HospiScope, as Mariana mentioned. And to the best of my knowledge and to the best of our collective knowledge, we're the only company that does this. And when we track it over time, because we've been doing this for about 5 years now, when we track it over time, it really enables us to understand how the installed base of equipment is shifting and how it's evolving year after year. And what we're seeing, or the year-end 2018 results indicate that Mexico has demonstrated a considerable growth in terms of the installed base that it has in many categories. Brazil as well, slightly lower numbers, but still consistent growth. And on the contrary, we're seeing that certain markets are contracting, like is the case of Colombia. Now, again, this is tracking year over year. So these are 2018 year-end numbers compared to 2017 numbers in terms of growth and trends. Juan Carlos, you live in Colombia. You operate in one of the region's best and most renowned institutions as the Fundación Cardio Infantil. What's happening in the Colombian market? Why are we seeing this contraction in terms of the installed base? And are you being affected directly as the Fundación?
Okay, in Colombia, we are facing now a very complex situation because of the financing of the healthcare system is not guaranteed according the mission that have been established in our constitution. Colombian 25 years ago defined that we have a full coverage for full of population, and this is definitely a huge challenge from the finance perspective. So now, 25 years before, we are facing serious problem in how to finance the system. No matter we have made a lot of reforms in the law, and we have two different perspectives, the private hospitals perspective and the public. In private hospitals, we are looking that external companies, foreign companies are buying hospitals, are investing. Private hospitals are growing in a very interesting pace. But on the other hand, public hospitals are not investing almost at all in technology. So at the end, as in the mix of public and private hospitals, public may the 7% of the share, private just maybe around 30. When you are these huge finance problems in the public sector, this contraction in the public definitely affects the medical devices industry, but we need to understand where to put the efforts to bring technology and how to grow in private side.
Correct, absolutely. And that's a very good point because, when we look at the data on a macro level across the region, we're seeing that approximately 60% or 65% of hospitals are indeed from the private sector in terms of number of institutions. However, when we're looking at the number of beds, which is really a much more telling and much more direct proxy for the amount of care that's given, we're seeing that that proportion is reversed, and approximately 60 to 65% of the beds across the region belong to the public sector. And so any kind of contraction on the budgetary front in that will impact to much greater scale where the healthcare system is growing of any given country. Patricia, you live in Mexico. You oversee, obviously, Philips operations. You've had regional roles. How do you see Mexico's 2018 growth in terms of the installed base of this equipment? Do you see it being sustainable moving forward, or was this really a unique one-off event that we're seeing?
I think these numbers are in line with the previous information that you already have shown. If you can see, let's say the most basic kind of systems are consistently growing, and I agree with that. We have an important install base, in the country. And so in any case, you need to replace it with a periodicity. So you can count on maybe some years it's going to continue with less energy and some others faster, but you will have a basis to grow constantly. But when you talk about more advanced systems, as it could be the angiograms or cath labs or the nuclear medicine, this impact could be driven for only few rooms or few equipment. So you will have some peaks in the years that you have important replacements. And for example, example, talking about are one of the installed package in government. So we are to the government cycles, and it's something that we need to work on. And well, it is even more important when you talk about oncology or nuclear medicine technology. You have a very small install base in Mexico, and I think it will be for some other countries that few systems will make you a huge difference. And I think it's what we are seeing here.
Absolutely. So, specific modalities that are very complex, very costly to operate. And we can even go as far as talking about robotic surgery systems, right? That are $1 million investments. You only need a few to really see a very high growth in any of those categories. Very good point, Patricia. On the next slide, what we monitor also on a regular basis is the new sales within any given market based on import data. So that's our share scope solution. And again, we break this down by modality. What's interesting is that there's a direct correlation between the new sales in the market with that of the installed base that we're also monitoring in the market. Mexico, again, showing consistent growth within multiple modalities. Brazil, some ups and downs, but generally positive. And Colombia seeing a contraction. So it's not just a contraction of the installed base, but the reason for that contraction being that new equipment and new sales are not really taking place. Juan Carlos, from your perspective, is this something that we expect to see moving forward? Do we expect to continue seeing a contraction of the healthcare system in Colombia that, quite frankly, has been very noble and very consistently growing up to just only a few years ago? So are we going to see a reversal of this, or should we expect for 2019 to continue seeing a bit of a contraction here?
What we are facing in Colombia is 6 months before the change of the government. We have a new Ministry of Health. We have a new strategy. They are reconsidering how to get the funds to finance how to invest in the public sector. But from the private hospitals perspective, what I think is the technology companies need to understand that today is not only about sell equipment. Today we need to discuss how to offer complete solutions, looking for the patient safety and patient experience at the best cost. Is something about value-based healthcare. We all the players need to think about how to offer the best for the patient at the lowest cost, and we need to build together new models of negotiation. We need to understand how to more than just sell the MR or CT. We need to understand the patients, what we are going to impact, and the outcomes that we are going to offer for these patients. So what I consider is we need to have a new discussion with the industry and create new models of negotiation based on the value we are offering to patients. So that's my perspective. We need to create a whole new conversation between the players in healthcare sector.
So Juan Carlos, this is an absolutely fascinating comment. You touch upon multiple very good points. And I think that the situation in which Colombia is in, where we're seeing a decrease in the installed base, we're also seeing a contraction in sales, really pushes the need forward for a new discussion, for a new way of looking at things that really could be a trendsetter for the rest of Latin America. Some of the two elements that really stand out to me in those comments are, one, the element of value-based care and the need for value-based care and how that's evolving. And two, looking at beyond sales. We can maybe regroup it as beyond sales. What are we looking at in terms of commercialization strategies? And to that specific point, let me hand it over to Patricia. What are you doing in terms of Philips, in terms of an institution, to go beyond the sales element and look at patient outcomes or commercialization strategies or even value-based care?
Well, talking specifically about Philips, we have a new complete area globally, and of course, it's present in Latin America and in Mexico, that it's called like this, solutions. So as Juan Carlos mentioned, we don't want to sell boxes or systems anymore. We want to go further. So we are very open to talk with all our clients, or even if they are not our clients, other institutions, to find the best way to approach and solve or improve the situation that we are seeing right now in the market. So we have equipments, of course, we have service, we have software, we have a big part of our portfolio, it's now software, and we are integrating that and even partnering with some other private institutions, other brands, other public institutions to offer the best answer that we can to our new clients or to other institutions. And something that we haven't talked about, I think you mentioned before that, Guillaume, it's about the impact of the home care. We are including that in our patient journey and our solutions. We talk a lot about the chronic diseases are increasing, and we'll continue that trend in the future. And we have realized that 30 to 40% of the tests and proofs that are needed by the chronic disease patients could be done at their own homes. So there we have a lot of capacity that we can free from the hospitals. We can improve the cost, and we can improve the health of the patients, the quality of life.
Absolutely. So several solutions to help reduce the costs in such contracting markets, such as, you're mentioning the home care solutions. We mentioned earlier telemedicine. We're also mentioning interconnectivity of multiple solutions. Again, we're moving away from the model of being a chain-linked fence to a much more holistic approach of healthcare. Bill, what are your thoughts on that? And I'm going to take the opportunity to open it up again to what we're talking about, the digitalization of the patient journey. I know that digitalization is a central role for you at RICO today. And what are your thoughts and comments on that?
Guillaume, it's really like basic, like Patricia was stating. One of the things that that RICO is trying to do is to be able to integrate all these different type of solutions and equipment, devices, software, and even personnel to be able to provide the total solutions to the industry, but also to be able to provide it as a service. So they don't have to spend the capital dollars, because sometimes, like Juan Carlos was saying, is not there. So how can we help our customer to be able to receive the best technology, the best services, the best solution, and be able to provide it as a service? So that is the key that we drive in within RICO. And back to the questions regarding the digital transformation, every single solution that we created for the healthcare industry is really concentrated. How can we facilitate to our customers the digital transformation? Trying to eliminate the paper, the amount of documents that we actually produce for any given patient. So we try to, even from the point, like I think Patricia was saying, or Juan Carlos, even how do you use your devices to be able to be connected to the point that you start making the initial appointment, trying to show up at the clinic. Instead of filling all this paperwork by hand, you can have it electronic forms or the digital forms, and be able to keep all the records in a digital format. And at the same time, to be able to connect all these different type of solutions to the electronic medical records. And in the US versus Latin America, there's a lot of different EMRs in the field, and some of them in the clinics and hospital that we see is homemade electronic medical records. So you have to be able to study, analyze, and do the assessment to be able to provide the right solution and the right recommendation to be able to integrate all the above.
Bill, great comment. Thank you so much. In terms of the digital transformation and digital technologies, We have one more poll question, but quite frankly, I've been made aware that we have extreme audience participation in terms of the questions that are being brought forward. So Mariana, back to you as an MC. May I propose that we skip the last poll question and go straight into the Q&A. And to all the folks that are attending here today, if we do not get to your specific questions, we will get to it following the webinar. We will reach out to you and answer by email. So Mariana, please go ahead and kick off the Q&A session.
Thank you, Guillaume. We will start. We have, as you mentioned, a lot of great questions. The first question is for Juan Carlos. Latin America's healthcare systems continuously struggle with the availability of financial resources. What are some of the available solutions, either in terms of purchasing or in terms of utilization, to make sure that budgets are spent wisely?
Okay, great question. What we are doing in cardioinfantil is focus on efficiency. And efficiency handled with our first priority, which is patient safety and experience. So before we establish that our ecosystem is patient-centric and our first priority is patient as the center of care, we start to implement a lean healthcare program at the whole hospital. We are implementing the lean healthcare procedures focused on capacity utilization and efficiency. So what providers need to do is understand what is the current installed capacity and explore the current capacity at the most with different techniques like Lean, Six Sigma, or reengineering, whatever we want to use. What we have the responsibility to optimize the installed capacity through continuous improvement programs. And we definitely identify a need to grow and acquire a new equipment. For instance, we just bought a CT 2 weeks ago. $1 million is the base cost, but we don't have $1 million to invest. So what we is get together with the vendor and understand how to build a common solution for both parts. And we sign a memorandum of understanding and a confidentiality agreement. We share all our population with the vendor. We understand the kind of patients we are serving. And at the end, we define a model when we are going to pay this equipment with the profits that we will be generating in the day-by-day operations. So we don't have to invest and impact our cash flow. Maybe we define an operational expenses model based on the profits that will be receiving from the volume. And we got it. Now we have our CT. Now we without an investment, but we have a new model to offer the best results for the patient and access for technology without to invest a huge amount of money. What will be the next step? The next step will be understand how to link these payments to outcomes. If we have better outcomes, maybe we have a differential quote or differential fee. And if we don't achieve the best outcome for patient, maybe we have some discount rate or something like that. But we are definitely thinking different. That's my conclusion.
Thank you so much, Juan Carlos. The second question we have here is for Patricia. Patricia, how do you see the future of integrated solutions in terms of equipment, services, connectivity, and the growth of home care?
Thanks. I think I already mentioned a little about this, but I would like to go further now. I think I'm very in favor about the private and public associations. I think we have to still working in how is the best way to approach, and we have good examples of success in the region, not only in Mexico, in Brazil. They have some good examples of this. But now we are challenging in other areas, like in example, the doctors and medical staff. You have a hospital that it's running greatly, the productivity is super high, but then you don't have enough doctors and medical staff to uh, even improve that number of outcomes, as Juan Carlos was saying. So we need to work more in how to improve that. And that's something that we can help as providers, yes, of course, but it's something where we need some help from the governments too. So I think the answer is always work together, governments with private institutions.
Absolutely. Thank you, Patricia. Bill, how do you see the use of artificial intelligence playing a role in the future of healthcare and the ability to broaden access to care?
Like I was trying to mention it before with the smart solution that is composed of these three modules, the artificial intelligence is the key to productivity and accurate treatment for the patient. Remember, the amount of data that is there based on a specific data that is collected is amazing. There's no way that we can read all these different books and be able to have all this knowledge with the artificial intelligence. For example, taking out of the context with the medical field, even legal attorneys. We have paralegals, right? And they have to read and research all the specific cases when I go into a trial. With the artificial intelligence, you have all this data there in your fingertips. So I think that that's the way that I was actually joking with a friend of mine that we were saying, and we were looking at this huge presentation of the intelligence and the capabilities for the Watson solution is one of the things that we use. And IBM is amazing. And we keep saying they're going to be replacing us, because the amount of knowledge and information that you can have in your fingertips is unmeasurable.
Yes, absolutely. Thank you, Bill. I think we can address one last question. We're running out of time. We actually are 2 minutes over it. So the last question is an open one. Would you agree that financing and regulations for new technologies are very complicated and take very long for approval?
I would agree in terms of the period of time that we can, since there is a new technology available until we can use it in one hospital. In average in Mexico, it's the longest one, that it's about 4 years. So in the region, the average is about 1.2, 1.5 years, something like that. So I think we are a little behind the average. Yes, we need to work in how we can improve this to, at least in Mexico, go to the average to have available this technology.
Got it. Thank you. Well, thank you everyone again for participating. This has been a great webinar. We have a lot of unanswered questions. Please keep in mind that we will be answering them, addressing them, and we'll be sending a reply between today and tomorrow. And we will also be sending the PowerPoint to everyone in the next 24 hours so you can review it on your own time. And just to let everyone know as well, if you have any other questions, please feel free to reach out to us. We'll be happy to address them as well. Thank you everyone for participating today.
Thanks for the invitation.
Thank you.